3 people are dead, several more are infected, and the virus that killed them was just confirmed as the one strain of hantavirus that can spread from person to person. I've got patients with World Cup tickets in Dallas, LA, and Miami. 2 of them texted me this week asking if they should cancel. This video is my answer to them and to you. Here's where the mainstream news isn't connecting. In 6 weeks, between 5 and 10 million international visitors are about to fly into 11 American cities for the FIFA World Cup. That's bigger than the population of Los Angeles, the largest temporary migration onto US soil in modern history. And many are coming from the exact region this live virus lives in. I'm Dr. Zaid Fadul, founder and CEO of Bespoke Concierge MD. I'm not here to scare you. I'm here to give you the facts your family doctor hasn't heard yet and tell you exactly what to do. Stick around until the 9-minute mark. That's where I give you the exact 24-hour decision tree that could save your life if you get sick this summer. Don't skip ahead. You need the context first. Okay, let's dive in. Most people by now have heard of hantavirus. You probably picture mouse droppings in a cabin, and you'd be right. Almost every hantavirus on Earth spreads one way only, rodent to human. Andes virus is the exception. Andes virus, or ANDV, is the only hantavirus ever documented to spread from person to person. Its natural host is a small rodent in rural Chile and southern Argentina. But unlike any other strain, once Andes virus gets into a human, that human can pass it to another human through respiratory droplets and saliva. Every other hantavirus respects the border between mouse and man. Andes doesn't. The World Health Organization has confirmed the Andes strain in the cruise ship cases. Their working assumption, human-to-human transmission is happening right now. But just how contagious is it? Many doctors might hedge on this, I won't. Yes, this strain is contagious, and the conditions matter. The landmark study is the 2018-2019 Epuyén outbreak, published in the New England Journal of Medicine. A rural Argentine town of 2,800 people saw 34 infections and 11 deaths, a 32% case fatality rate. All traced back to 3 super spreaders. One attended a 90-minute birthday party while feverish. 5 people sitting near him got infected. Another had an active social life during early symptoms. He infected 6 more before he died. A third attended her husband's wake while running a fever. She infected 10 more. Those 3 people drove 64% of secondary cases. And here's a stat that should stop you in your tracks. In 52% of transmission events, the only contact happened on the first day of fever. That's right, half the cases spread on the first day with a fever. Which means the real question is, can you even tell when someone is contagious? Andes virus has an average incubation of 18 days, ranging from 7 to up to 39 days. So you could pick up Andes virus and not show symptoms until 6 weeks after the World Cup. What's crazier is the virus is detectable in the blood up to 2 weeks before you feel a single symptom. When symptoms hit, it has a pretty distinct pattern. High fever, usually above 101 Fahrenheit, severe fatigue and muscle aches in the thigh, the hips, and the back, a bad headache, and abdominal pain, nausea, and vomiting. It looks just like the flu, even to trained clinicians. People go to work, they board planes, they sit in stadiums. Then, usually a week or 2 later, it turns. Lungs fill with fluid, the heart weakens, and the blood pressure crashes. More than half progress to hantavirus cardiopulmonary syndrome. The fatality rate is 35 to 38%. Roughly 1 out of 3 people will die after contracting this virus. That's not the flu, it's not COVID. That's once in a generation lethality, and there's no antiviral, no vaccine, no cure. Now here's where this stops being a South American problem. Let me be honest, when I first saw this outbreak on Sunday, I thought it was probably another sin nombre cabin mouse case. I was wrong. Once WHO confirmed the Andes strain, my entire risk calculus changed, and so should yours. FIFA projects 5 to 10 million international visitors pouring into 11 US cities between mid-June and mid-July. That's more than Denver, Seattle, Boston, and Miami combined. Fans from Argentina and Brazil, 2 of the top 3 ticket-buying nations, live for soccer and are coming here in droves. Argentina is the global epicenter of Andes virus, with at least 20 deaths reported between July 2025 and January 2026. And hantavirus isn't the only disease riding shotgun with the World Cup. Measles, mpox, dengue, chikungunya, and drug-resistant TB are all on the 2026 threat list. I ranked the top 5 in a separate video. The link will be in the description. If you remember the last new respiratory virus, H1N1 in 2009 or early COVID, you know how this goes. The first 30 days are when decisions matter most. So, what is the US government doing to screen people at the airport? Almost nothing. And it wouldn't work anyway. During SARS, Toronto and Vancouver airports screened over 700,000 travelers and detected 0 cases. The WHO itself concluded border temperature screening is not effective. Andes virus incubates up to 2 weeks before symptoms. A person with a high temp can take Tylenol an hour before landing and walk past any thermal camera. Temperature checks are security theater. The real solution is pre-departure screening in the origin country before they board. That's how Taiwan managed dengue and Singapore handled SARS. It requires bilateral cooperation with Argentina, Brazil, and Chile, and WHO coordination for real-time outbreak data. Here's a problem. The United States withdrew from the WHO in January. When WHO posted this outbreak alert on May 2nd, every member nation received it in real time except us. We're not in the room. We're reading the news with you, which means the government is not going to protect you from this. You have to. So what does that actually look like? The highest risk environment for most people is a long-haul flight. Filtered air helps, but if you're sitting next to someone early in their fever, you can definitely pick up Andes virus. A 2024 Lancet infectious disease study confirmed the virus replicates in lung tissue and salivary glands, with infectious particles recovered from 42% of positive samples. So here's your flight risk breakdown. Under 2 hours, low risk. Mask only if someone nearby is clearly sick. 2 to 4 hour flights are moderate risk. Use an N95 if you're older, pregnant, immunocompromised, or next to someone feverish. Flights over 4 hours, especially from South America, using an N95 mask is smart and low cost. And indoor fan zones, packed bars, airport terminals, and mass transit are medium risk. I will cover those situations in a moment. Now, a surgical mask is a participation trophy. You need a properly fitted N95 mask. My beard messes up the fit, for example. Check out my N95 Fit Check Explainer video linked above. And an N95 is just one of 12 items in my World Cup medical kit. Pulse oximeter, OTC flu and COVID tests, insect repellent, electrolytes. My full under $200 prep breakdown will be linked above when it's live. For most of you, your World Cup exposure won't be on an airplane. Let me walk you through the situations you'll face over the next 2 months. Public transit is medium to high risk. On a bus or subway for 45 plus minutes in a host city like Dallas or New York, and you're in a recirculated airbox with strangers 18 inches away. There's already documented bus transmission of Andes virus in the CDC literature. One passenger infected another during a ride. On your way to a match or work, wear a fitted N95. It's a mild inconvenience against a disease with no cure. Sports bars are the most underrated risk of the tournament. Indoors, badly ventilated, packed shoulder to shoulder, everyone shouting. And shouting generates more infectious aerosols than coughing does. Sit near an open door. If you're elderly, pregnant, or immunocompromised, watch at home with a few friends. Ubers and airport shuttles are mostly fine. Full van shuttle for 45 minutes with somebody coughing? Roll down a window. And don't forget the judgy side eye. Hotels and Airbnbs are low risk. Assume your Airbnb just hosted international visitors and wipe down doorknobs, remotes, and light switches on arrival. Andes virus is killed by standard alcohol-based sanitizer. Outdoor fan zones and tailgates are the safest venue of the whole tournament. Natural airflow disperses aerosols fast, so enjoy yourself. And finally, wash your hands and actually mean it. 20 seconds of real hand washing breaks the chain for Andes, the flu, norovirus, and COVID all at once. It's the highest return medical behavior on Earth. The real challenge is in the personal contact we all enjoy. Every outbreak report you're going to read over the next 2 months is going to use the same phrase, close contact. Public health officials say it, news anchors repeat it, but almost nobody explains what it actually means. So let me clear that up, because it's the single most important concept for protecting yourself from Andes virus. Close contact is not a handshake. It's not passing someone in the stadium concourse. It's not standing next to a stranger in the checkout line. Brief encounters almost never transmit this virus. Remember that fun phrase, social distancing? Close contact means prolonged exposure within about 6 feet of an infected person. In practical terms, sleeping in the same room, sharing a long car ride or airplane row, eating across a small table for an hour, or caring for someone sick without protective equipment. Time and proximity are 2 variables that matter here. Intimate contact is a step beyond that. It's a direct exchange of respiratory droplets and saliva. Deep kissing, sharing drinks, utensils or toothbrush, sexual contact, breastfeeding. These are the routes antivirus transmits most efficiently because the virus actively replicates in the salivary glands and lung tissue. Which brings us to hooking up during the World Cup. With Brazil and Argentina being ground zero for Andes virus, their citizens being rabid soccer fans coming here in droves, and the allure of foreign talent, it's become the poison fruit from the forbidden tree. The World Cup is the biggest party on earth, and yes, I'm a doctor on YouTube telling grown adults to ask about fever before you hook up. Welcome to 2026. Andes virus lives in saliva. A condom does nothing to protect you from that. Zero. Whether you're hosting a visiting relative, caring for a sick friend, or meeting someone new at a fan event, ask the one question that matters. Has this person felt feverish, achy, or fluish in the last 3 weeks? If yes, create distance until they're cleared. That single habit breaks the chain. Now, the moment I promised you in the intro, this is the chapter that could save your life. If you develop fever over 101 Fahrenheit, severe muscle aches, headache, or GI symptoms within 6 weeks of any World Cup exposure, step 1, test at home immediately. Over-the-counter flu and COVID tests are $20 at most pharmacies. There are prescriptions available for both illnesses. Step 2, if flu and COVID are negative and you still have symptoms, do not sleep it off. Go to the ER, say these exact words: I have possible hantavirus exposure. Sleeping off Andes virus is how you miss the window to get ICU care that could save your life. Andes virus can go from flu-like symptoms to respiratory failure in 24 hours. People die because they take NyQuil, go to bed, and wake up in cardiogenic shock. By then, the window's closed. ICU supportive care works, but only if you show up. Now, let's cover something most doctors won't admit on camera. Most people don't have a doctor they can text at night when they get home with a fever. They sit in urgent care for 3 hours, get told it's probably just a cold, and go home without the right questions ever being asked. That's not medicine, that's triage. I'm not anti-insurance, I'm not anti-hospital, I'm anti-system. The system where you wait 2 months for an appointment, see a stranger for 7 minutes, and get told to come back if it gets worse, and pay $400 for that privilege. That's not medicine, that's customer service with a prescription pad. At Bespoke Concierge MD, my patients have my direct line. We do advanced diagnostics, travel medicine consults, and we have the time to ask the right questions before something small becomes fatal. If you've been thinking about what real, proactive, concierge-level healthcare looks like, the link to book a free discovery call is in the description. One question before you go. Are you still planning to go to World Cup match this summer? Drop going or staying home in the comments. I want to see the split. If you have more questions about hantavirus, I'm going live May 8th at 8 a.m. PST, and I'll be responding to comments in real time. The video on the right will be a replay of the event. The playlist on the left covers hantavirus and related health issues in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.